Good morning to you, to all those who help us here every morning, to Abdiel, who is in the studio, and to our audience following us from different parts of the country. One more day without deceased patients, the fifth consecutive day, and this is good news. As of 12 midnight, 400 patients were admitted to the country's hospitals, 9 in surveillance, 198 are suspects, and 193 are confirmed. 193 active cases in Cuba. In our primary healthcare system, our professionals and specialists are monitoring 552 people. Yesterday, the island's different molecular biology laboratories studied 2,582 samples in the laboratory of the Pedro Curie Tropical Medicine Institute, 925 in Havana's Provincial Center, and in the Center for Genetic Engineering and Biotechnology, 470 samples respectively. In Villa Claras, 307, in Santiago de Cuba's 196, and in the Brother Almeida's Hospital Laboratory, 224. As a result of the study of these 2,582 samples, 11 tested positive, representing 0.4% of the samples studied. Thus, in Cuba, 138,831 samples have been studied by our laboratories to diagnose COVID-19. And as a result, 2,273 have tested positive. 2,273 people have been diagnosed with COVID-19, 1.6%. Of the 11 cases confirmed yesterday, 10 are Cuban and 1 is a Congolese student who acquired the disease in our country. So he is not included among the cases who got the infection abroad. He's a Congolese student in Cuba. Of the 11 cases, 6 are confirmed case contacts, and 88.9% of the cases diagnosed in our country's epidemic have been positive case contacts. And we're talking about 1,983 people. Yesterday, in 5 of the cases, the source of infection had not yet been determined, and we continue the studies to trace the source of infection to determine contacts and conduct the actions prescribed. In the cumulative total in the Cuban pandemic, 88 of the diagnosed cases, their source of the infection has not been identified. I'm referring to 3.9%. With source of infection abroad, the figure remains unchanged, 160 with 7.2% of all patients. Of 11 cases diagnosed yesterday, 4 are male, for a cumulative of 1,151. In all the Cuban pandemic, 50.6% of all confirmed cases, and 7 of the cases yesterday were female, totaling in the pandemic 1,122 patients of the female sex confirmed with COVID-19. Unlike we have been reporting in the last few days, only 3 of 11 cases diagnosed yesterday were asymptomatic. This is 3 is 27.3% of, and there are already in the pandemic in Cuba 1,217 people who have been asymptomatic at the moment of the diagnosis. That is 53.5%. Nonetheless, over the last 15 days, of the 163 cases confirmed in Cuba, 127 have been asymptomatic, that is 77.9%. And I say this because today's results should not lead us to disregard the importance of the fact that this disease can be diagnosed without the carrier having symptoms, and to insist on the fact that the risk that this group poses is very high. By age groups, 5 cases were diagnosed in the groups of under 40s, no children reported among them, and their cumulative total of children, the number of 246, remains unchanged. 229 of them have already been discharged, and that is 93.1% have been discharged. We always reiterate that children diagnosed with COVID-19 in our country have had no complications, and it's been favorable. In the 40 to 59 years of age and over 60s, 3 cases each, totaling the 11 cases. 100% of the cases of the 11 diagnosed are from Havana province, distributed in 8 municipalities of the capital. In Havana, although the positivity rate is slightly lower, in the last 15 days it remains with the highest incidence, with 7.21 cases per 100,000 inhabitants, and it is followed by Matanzas with 1.25 per 100,000 inhabitants. The rest of the provinces, I always mention them: Artemisa, Ciego de Ávila, Granma, Pinar del Río, Mayabeque, Villa Clara, Cienfuegos, Santi Espíritus, Camagüey, Las Tunas, Holguín, Santiago de Cuba, Guantánamo, and the Isle of Youth Special Municipality have not reported any case, and a new case in the last 15 days. And sometimes I'm told, how come there are no cases in such provinces if a neighbor of mine or an acquaintance of mine was hospitalized, that person was tested, there has been contact tracing, and people contend that the information is being withheld. I want to make it clear that to talk here, to say that it has been over 15 days that these 13 provinces and the special municipality have not reported confirmed cases, in no way it means that all the established protocols are not being followed in those territories with respect to the treatment of suspected cases or people who may be a contact of a confirmed case, and the treatment is the same. If these procedures are not followed, obviously cases would not be diagnosed. In those territories, suspects are hospitalized, they are studied, contacts of confirmed cases or suspects are also hospitalized, and I repeat, the same protocols are followed, and that surveillance is what guarantees that there is no spread of this disease in these provinces. Even many times we are not satisfied, and that is why you have seen and heard about the population studies in places where there are no cases, so that no patient with the virus remains, especially taking into account the fact that many are asymptomatic and they are not detected and continue to spread and to transmit the disease. In Cuba, of the 2,273 patients diagnosed with the disease, 193 remain admitted. This is what we call in the system the active cases. And we always enjoy the good news that 188 of them, that is 97.4%, have a stable clinical condition without any complications. We always regret the death of 84 people who have died as a result of this disease in our country, for a lethality of 3.69%, and with this in the region of the Americas, Cuba remains in the 18th place in terms of lethality. So it remains in the same place. We have the two evacuees that we always mention. And yesterday we had another favorable indicator. 29 people were discharged, practically 3 times more discharges than confirmed cases. Thus, 1,994 patients of 2,273 diagnosed patients with COVID in our country, 87.8% have recovered and have a favorable evolution and are currently being monitored at home or back to their normal activities. We are reporting today 1 critical case and 4 in serious condition that we had mentioned yesterday, all of them here in Havana. 3 are admitted at the Salvador Allende Hospital and 2 at the Dr. Luis Diaz Soto Military Hospital. We are working on them and we really hope that they will recover. In terms of the world as of 12 o'clock last night, and you may wonder why using 12 midnight and we used that time as a closing cut, because after that hour people obviously continue testing positive and the number changes. People are testing positive and dying non-stop and the number changes. So as of 12 o'clock last night, the same 185 countries of the world remain reporting cases of COVID-19, and the number has reached 7,882,230 cases. 122,539 cases were confirmed yesterday. This is a very high number at a time in which it was expected that the number of cases would be dropping. And yesterday, 3,132 people died in the world due to COVID-19, totaling almost 500,000 fatalities. 433,259 for a lethality in the world of 5.50%. 5.5%. The region of Americas, as we have been saying in previous briefings, has become the epicenter of the pandemic, reporting 59,550 cases yesterday, for a cumulative of 3,848,098 confirmed cases. And this accounts for 48.82% of the total of cases in the world. And 1,818 people died yesterday in our region due to COVID-19, for 203,692 deaths, a lethality of 5.29%. To illustrate the risks this disease entails and the way it is spread, It is worth mentioning the countries leading the pandemic in the region. They are the United States of Americas at the top with 2,094,069 confirmed cases and 115,732 people who have died. Brazil in second place with 867,624 confirmed cases and 43,332 deaths. And Peru ranks third place in the region with 229,736 confirmed cases and 6,688 deceased. I provide all these details because it is good for people to be informed about what is happening in the world, and above all, to have a clear image of the behavior of the pandemic, which, despite all efforts, its control remains elusive.